I think on a day like this, it is important for us to remember that much as we face so many challenges in our country, but there are moments that really require or need us or call upon us to celebrate. This is one such opportunity where we acknowledge that nothing is insurmountable when we unite. We unite particularly for a greater cause, when we unite to try and lift our country and remain true to the dream that all of us share, which is so much contained in our national compact, our constitution.
It's a great honor for myself, a really great honor for myself and the MRC to be part of the National Health Scholarship Program and to be here to rename and launch the National Health Scholarship Program to entrench the legacy of Bongani Mayosi. In 2010, Bongani Mayosi chaired the consensus study on clinical research in South Africa that was convened by the Academy of Science of South Africa. This study showed that clinical research in the Republic was in urgent need of reform. It needed government support, it needed better strategic planning, and it needed better coordination. Bongani noted at that time that clinical research needed to be repositioned in South Africa within a more democratic, political and social context, built on the advantages of the past, but actively addressing the legacy of colonization and colonialism. He emphasized that clinical research should contribute to the improvement of the health of the nation and address our local burden of disease. To address this, we needed to revitalize clinical research and address the racial and gender imbalance of science in South Africa. From this report, the genesis of the revitalization of the MRC occurred. And I have to thank the Minister of Health for believing in the MRC at that time and not giving up on us and deciding it was time to revitalize the MRC and also to invest in clinical research like it had never done before.
When one supports a medical student to graduate, it's not only the medical student themselves who benefit by having an education. It is the whole community and ultimately the country that benefits.
I then received this beautiful gift from the amazing people who thought of this. It bought time for me, allowed me to be with my family, but then it also gave me protected time to focus on my PhD. And this gift, you didn't only give to me, but you gave to my family, to my extended family, and even my community.
I remember calling my mom on the verge of tears, telling her, listen, I'm not sure what's going to happen, but yeah, we were just hoping and praying for some miracle to happen. Then I remember I received a call from Prof Manning's office one Wednesday afternoon. I remember it was 2:30, I even remember the time. That's how much that moment changed my life. Yeah, so I always say this was a call from God because literally it was going down from there. So yeah, PHEF came along and literally saved my future. So seeing my father battle and wrestle with cancer till the end, it ignited my interest in oncology. And I was doing a bit of research a few weeks ago, and I realized there's a shortage of oncologists in this country, especially those of color. I truly believe we have to desire and aim for greatness.
My mom is proud, my siblings are proud, my community is proud, my church is proud, not just because of the title, but because they know that the help is nearer. It's been my dream to become a doctor, to help people since I was very young, as we heard from the clip.
It's been about 7-8 years. And I must say, I'm happy to report as well, my wife is now expecting our first child. So And I'm currently doing a postdoctoral fellowship at the Department of Psychiatry. And I just want to say thank you very much for giving me this opportunity and for this funding. To be able to, as one of the other scholars said as well, it's to protect you. It gives you enough to be able to survive and to be able to pay your bills, do your everyday things. It's a full salary essentially, which is not always that possible. It's very difficult for people, and a lot of people having to support families as well. And I must say once again thank you, the Minister, also to the Khumalo Bongazi families for what their father has done as well, and the different CEOs from the Public Health Enhancement Fund, and also the MRC executive for also providing this opportunity for me. I appreciate this very much. Thank you.
Now, if Bongani was here, he would be writing furiously your names as you each come up. And after this meeting, he would be following you and asking you, tell me, what's your 5-year plan? And if you don't have a 5-year plan and a 10-year plan, he would tell you to think about it and then let him know. And he would do his utmost to help you access whatever education that you needed. And what he always used to say was, you must play the long game. Don't think here, think there. Where are we going to be? And put systems in place to train a critical mass of academics, the young and the brightest, that will change the fate of Africa, where problems of Africa will be solved by Africans themselves setting their own agenda. And I do say that in the name of Bongani Mayosi and in his memory, this is a wonderful gesture, and I hope that as a country we will all be encouraged to do the same and to help anyone around us. You know, even your helper at home, take an interest. Do they have children? Are they going to school? What can you do to help them get an education? Because you'll be amazed at what contribution you can make to just that one family. Thank you all very much.
In November 2011, I had one of my routine meetings with CEOs of private health sector, the private health sector. Whenever we meet, one of the debates was always the NHI, among other health issues. On that day, there were 16 CEOs in the meeting. And I suggested to them that, frankly, I'm getting distressed about this idea of every time meeting and arguing and debating about NHI. I suggested to them that perhaps we should stop this debate and rather concentrate on building the human capacity of our country. And hence the CEOs appointed Dr. Ayanda Ntsaluba, who was standing here in front of you, as well as Stavros Nicolaou from Aspen, to work with the Department of Health to drive this idea forward. The fund has supported 41 students who have graduated with PhDs and 6 who graduated with a master's in science. This was the first indication that the Public Health Enhancement Fund had indeed started to build the human capital of the country as we had dreamed. So it's through working together that the country moves forward.
I want to commend the Minister and his department for taking this initiative today, because it does demonstrate to us, even though we've got differences, when we take leadership and apply our minds and exercise our best judgment, what South Africans can achieve is nothing short of miraculous. So this is another example of that. My only wish and plea is that as we navigate universal healthcare coverage discussions in our country, that we always default back to what the Public Health Enhancement Fund has achieved, to allow us to take those discussions forward constructively. There's no one, I think, that is not at idem that we need universal coverage. I think if you ask anyone in the country, I think it's just how do we get there working together that's important. And this provides DG a sound platform, I believe, for that to happen. So on that vein, may I take the opportunity of thanking our Honourable Minister of Health, Dr. Motsoaledi, selfless individual, works, 24 hours a day. I was in a board meeting last night, I think he was phoning me at 11. So, Minister, you never go to sleep. And I think we're most grateful for what you do for our country.